Hello everyone, I am Dr. Deepa. Today we will be learning about the pharynx. The pharynx is the musculomembranous tube which is lined internally by the mucous membrane. This pharynx is seen to extend from the base of the skull till the lower border of the vertebrae, that is the C6 vertebrae. So the extent of the pharynx is from the base of the skull till the 6th cervical vertebrae, and it is seen to be located behind the nasal cavity, behind the oral cavity, and behind the larynx. So accordingly, it has been given the name nasopharynx, oropharynx, and the laryngopharynx. So the entire pharynx is divided into three parts. The part behind the nasal cavity makes up the nasopharynx, the part behind the oral cavity makes up the oropharynx, and the lowermost part of the pharynx, which is behind the larynx, make up the laryngopharynx. So these are the three parts of the pharynx. When we talk about the length of the entire pharynx, the length of the entire pharynx is about 12 to 14 centimeters in size. When we regarding the width of the pharynx, the maximum width of the pharynx is at the level of this nasopharynx. At the level of the nasopharynx, the width is about 3.5 centimeters, and the minimum width of the pharynx is about 1.5 centimeter, which lies at the level of the pharyngoesophageal junction, where the pharynx becomes continuous with the esophagus below. So this is about the measurement, the location, and the extent of the pharynx. Regarding the external relations of the pharynx, this pharynx is located beneath the body of the sphenoid, the basilar part of the occipital bone. As we can see, the pharynx is related above to the body of the sphenoid, the basilar part of the occipital bone, and the anterior arch of the atlas over here. Below, it is continuous with the esophagus at the level of the 6th cervical vertebrae. In front, as I have already mentioned, the pharynx is in continuation with the nasal cavity, the oral cavity, and the larynx through the laryngeal inlet. And behind, the pharynx is supported by the upper 6 cervical vertebrae along with the intervertebral space, as we can see here, and also the space, that is the retropharyngeal space. So when we talk about the posterior relation of the entire pharynx, posteriorly, as we can see, the pharynx is related to the upper 6 cervical vertebrae and also the intervertebral disc in between the vertebrae. Along with it, when we look into the more deeper plane, and in front of the vertebral column lies the retropharyngeal space, which is the space present behind the pharynx, and along with it, it is also related to the pre and the paravertebral muscles. So all these make up the posterior relations of the pharynx. So posteriorly, in short, the pharynx is related to the cervical vertebrae, that is C1 to C6 vertebrae, and the important space, that is the retropharyngeal space, which lies behind the pharynx and in front of the vertebral column. On each side of the pharynx lies the styloid process of the temporal bone, along with the styloid group of muscles, the carotid sheath with its contents, and the lateral lobe of the thyroid gland as well. So they make up the lateral relations, that is the relations on each side or the relations on either side of the pharynx. Next, moving on to the interior of the pharynx. In this video, we will be discussing in detail about the nasopharynx, which is also called as the epipharynx. Yes, the nasopharynx is also named as the epipharynx. The nasopharynx is situated behind the nasal cavity, as we all know, and above the soft palate. So that part of the pharynx which is located behind the nasal cavity and above the soft palate, which is seen over here, makes up the nasopharynx. This nasopharynx has got the anterior boundary, it has got the posterior boundary, it has got the roof and the floor, and of course the lateral walls. Moving on to the boundaries one by one. As we can see in this picture, this is the atlas view or the sagittal section showing visualizing the nasopharynx. This is the hard palate the palate separating the nasal cavity above from the oral cavity above, the sagittal section representing the nasal septum. So anteriorly, this nasopharynx is bounded in front. It is in continuation with the nasal cavity in front through the cornea of the nasal cavity. So anteriorly the wall is deficient and it communicates with the nasal cavity through the vana. So this is the cornea of the nasal cavity. The roof and the posterior wall are continuous. So the roof and the posterior wall slopes down as we can see over here, and it is mainly made up of three bony components, that is the body of the sphenoid, the basilar part of the occipital bone and the anterior arch of the atlas. So we can make out all the three, the body of the sphenoid, the basilar part of the occipital bone over here and the anterior arch of the atlas. As we can see over here, the roof and the posterior wall represents certain features which are three in number. The roof and the posterior wall of the nasopharynx represents three components. It represents three components. Number one is the pharyngeal tonsil, or it is called as the nasopharyngeal tonsil. It is called as the nasopharyngeal tonsil, number one. Number second is the pharyngeal bursa, or simply the nasopharyngeal bursa. So these are the two important components which are present or located along the roof of the nasopharynx. So the nasopharyngeal tonsil is nothing but the aggregation of the lymphoid tissue which lies beneath the mucous membrane. It is projected downwards and forwards. This nasopharyngeal tonsil, or simply called as the pharyngeal tonsil, is more prominent in case of children. In case of adults, it gets atrophied. Next, moving on to the bursa, which is called as the nasopharyngeal bursa. This nasopharyngeal bursa is also known as the pouch of Luschka. It is also known as the pouch of Luschka. So this pouch of Luschka is the nasopharyngeal bursae. It is the mucosal diverticulum which is seen to extend upwards within the nasopharyngeal tonsil. It is nothing but the small mucosal diverticulum which is seen here, which is seen to extend into the nasopharyngeal tonsil as seen over here. This nasopharyngeal bursa is containing the mucous glands, and sometimes this secretion of this gland may seem to be blocked in certain conditions. So this is about the pouch of Luschka, which is also called as nasopharyngeal bursa, which contains the mucous glands within it. Sometimes there is a third component which is seen along the roof of the nasopharynx, which is called as the pharyngeal hypophysis, which is called as the pharyngeal hypophysis. This pharyngeal hypophysis is present above the nasopharyngeal tonsil, this is located above the, if present, it is located above the nasopharyngeal tonsil. It is a glandular tissue which is histologically or microscopically similar to the adenohypophysis. It is similar to the adenohypophysis. hypophysis which is present along the roof of the nasopharynx. These cells are derived from the backward extension of the rat case pouch. They are seen to be derived from the backward extension of the rat case pouch over here. So this is about the nasopharyngeal bursa. So these are the three components to be known which is present along the roof and the posterior wall of the nasopharynx. Number one is the pharyngeal or the nasopharyngeal tonsil. Number second is the nasopharyngeal bursa, which is called as the pouch of Luschka. And the third component, if present, is the pharyngeal hypophysis, which is nothing but the glandular mass of the adenohypophysis. So this is about the structures present along the roof and the posterior wall of the nasopharynx. Moving on to the floor of the nasopharynx, as we can see over here, the nasopharynx is free in its lower part and it is continuous with the oropharynx below. Yes, the nasopharynx is in continuation with the oropharynx below, which is separated by the isthmus, which is called as the pharyngeal isthmus. So the nasopharynx is separated from the oropharynx by the small constriction which is called as the pharyngeal isthmus, which is called as the pharyngeal isthmus. So this pharyngeal isthmus separates the nasopharynx from the oropharynx. The dotted line which is seen here represents the pharyngeal isthmus. This pharyngeal isthmus is related in front to the soft palate, as we can see over here. It is formed in front by the posterior surface of the soft palate and the free margin of the soft palate behind. Posterior wall of this pharyngeal isthmus is limited by the pharyngeal wall, where it represents a ridge or the elevation which is called as the Perseverance ridge. This Perseverance ridge is formed by the palatopharyngeal sphincter. So the posteriorly this isthmus is formed by the Perseverance ridge. On either side, the isthmus is completed by an arch which is called as palatopharyngeal arch. It is completed by the arch which is the palatopharyngeal arch with the muscle lying deep to it. So this is about the pharyngeal isthmus. I repeat, the pharyngeal isthmus is formed in front by the posterior surface of the soft palate as well as the posterior margin of the soft palate. Behind it is limited by the Perseverance ridge, and on either side it is limited by the palatopharyngeal fold. So this is about the floor of the nasopharynx. Moving on to the lateral wall of the nasopharynx. The lateral wall of the nasopharynx again represents certain features. This is the area representing the lateral wall of the nasopharynx. The lateral wall of the nasopharynx again represents three features. It contains three components. The lateral wall contains three components, as we can see. Number one is the pharyngeal opening. As we can see here, number one is the pharyngeal opening, which is also called as the tubal opening or the auditory tube opening. Number second is the tubal elevation. Number second is the tubal elevation, and number third is the pharyngeal recess. Number third is the pharyngeal recess. So there is a number second is the tubal elevation, and number third is the pharyngeal recess. The lateral wall of the nasopharynx represents the tubal opening, which is the opening of the auditory tube along its pharyngeal end. This is the opening of the pharyngeal end of the auditory tube, which is seen over here. This tubal opening or the pharyngeal opening is located about 1.2 centimeters behind and slightly beneath the inferior concha. So just below and behind the inferior concha lies the opening of the auditory tube. This auditory tube is limited above by the elevation which is called as the tubal elevation. So what we see here, the one which is in orange color represents the tubal elevation, which is the elevation which are seen along the upper and the posterior margin of the auditory tube. Just above the tubal elevation lies the tonsillar mass, which is called as the tubal tonsil, So the tubal tonsil is the tonsil, the aggregation of the lymphatic tissue, which is seen just above the tubal elevation, Other than that, there is something called as the pharyngeal recess, which is also called as the fossa of Rosenmullar. So the pharyngeal recess is called as the fossa. It is called as the fossa of Rosenmullar. This fossa of Rosenmullar is nothing but the mucosal depression. It is nothing but the mucosal depression which lies behind the tubal elevation. So we can see the tubal elevation over here. Just behind the tubal elevation lies the pharyngeal recess, which is also named as the fossa of Rosenmullar. So this is about the features present along the lateral wall of the nasopharynx. This is again the mid-sagittal view showing the interior of the nasopharynx, as which has been already discussed. The torus tubaris present above the pharyngeal opening. We can make out the pharyngeal opening or opening of the auditory tube. We can make out the fold, that is the salpingopharyngeal fold, all of which is present along the lateral wall. The roof represented by the pharyngeal tonsil as well as the recess, which is called as the pharyngeal recess. Lastly, moving on to the clinical aspect of the nasopharynx, the adenoid is the commonest infectious condition seen in case of the children, which is mainly due to the inflammation involving the nasopharyngeal tonsil. So the inflammation involving the nasopharyngeal tonsil leads to the condition called as the adenoids in case of children. This nasopharyngeal tonsil, when enlarged due to infection, leads to the obstruction in the nasal respiration. Which makes the mouth breathing obligatory in case of children. So the kids representing with the breathing through mouth or the mouth breathing, one of the cause may be the swollen nasopharyngeal tonsil or the swollen adenoids, which obstructs its respiratory passage. This adenoids may lead to the typical condition or the typical phases, which is called as the adenoid phases. The second clinical condition which is to be noted here is the Tonward's disease. Sometimes the mouth of the bursa, that is the pharyngeal bursa, is blocked and there is retained secreted material of the mucous glands present within it, which lead to the cystic swelling. So this condition is called as the cystic or the Tonward's disease. So the Tonward's disease is nothing but the cystic swelling which is seen at the area of the pharyngeal bursa, which is due to the retained secreted material of the mucous glands present deep to it. Next is the area of the pharyngeal opening or the Eustachian's tubal opening, which is important clinically. This torus tubaris, which is the tubal elevation present above the nasopharyngeal opening, it acts as the above the auditory opening. This torus tubaris acts as the guideline. It acts as a guide for the location of the auditory tube, and hence the insertion of the catheter is made easier to inflate the air in an attempt to get relief from the symptoms of the retracted tympanic membrane. Hence, so that the air pressure on either side of the tympanic membrane is maintained equally. So this is all about the clinical aspects of the nasopharynx. In next video, we will be looking on to the left portion of the pharynx, that is the oropharynx and the laryngopharynx. Thank you.